welcome you all to Apollo Hospital today. As you know, in Apollo Hospitals on 2nd of February, with the help of police and Metro, we could bring a heart from Kamneni Hospital from LB Nagar to Apollo Hospital, from that end of the Hyderabad city to this end, within a very short time to save a very critical patient by doing heart transplantation. This never happened before. See, the transplants have been happening here and there in the country, but certain problems we face in this country, especially what is applicable in developed countries doesn't apply here. We have created previously a green channel here with the help of police, because what happens is when you take an organ from a donor, the greatest thing in the whole thing is, the greatest person as we know is a donor. As Dr. Hari Prasad Garu said, unless they donate, there's nothing here to move forward. So once the patient there had a bleeding in the brain and is declared brain dead, attendants were kind enough to donate the organs to save other patients. So that day we wanted to bring the heart to save this Kanakareddy Garu, but Kanakareddy Garu was in a very serious critical condition. His heart was not working, kidneys were not working, not able to lie down. His blood pressure is being maintained with special medicines for last 1.5 months. And to save him, we need to bring the heart in good condition as fast as possible. So from Kamineni, by the time I went there, it took me 15 minutes to reach the place in an ambulance from Apollo in the morning. I know it's going to be very difficult to get the heart within a short time. Unless I put it in 2 hours, 3 hours time, in this critical patient, it may not be possible for us to save this patient. So that time I'm not sure what to do, whether I should go ahead with the surgery or not. We know the patient is critical and they are willing to take the risk, but taking this much risk knowing that he may not come out. And we do not have facilities like helicopter facilities like in developed countries. That time a flash thought came, whether we can take the help of a metro to transport the organ. We know this never happened in the world, but that moment probably it's as he said, God-sent thought, probably it has come, and I expressed this thought to our CEO Subramanian Garu, whether we can look at this. Metro, we know Metro has been doing a great job and people are happy here, but for a cause like this, we know they have spent millions on this, and we also know they are running in huge losses. Can we ask for a special train? But then Subramanian Garu spoke to NVS Reddy Garu and the L&T team, and they immediately accepted, so kind of them, to put a special train to bring the organ so that it can come very fast, excluding all this traffic in a green channel on a metro, stopping all the trains. And now we know, so we could bring it. The police helped us to bring the heart to the Nagaur in 2-3 minutes, and the train did not stop anywhere through 16 stations. It came non-stop in about 29 minutes to reach Jubilee Hills. From there in 2-3 minutes we were here, and we could put the heart in about 2 hours 45 minutes. The heart started working, and the patient who was on deathbed, by next day, fortunately this heart is working so well, his organs are picked up and we could remove the ventilator, started walking in 2-3 days time, and by 12th day, like any other bypass surgery or open heart surgery, ready to go home. And all this was possible because of so many people have come together, not just the doctors. It is our responsibility for the doctors and the hospital to do it. But without the help of police and especially Metro this time, I have seen the comments from abroad, ministers in developed countries saying that so far we never realized that we can make use of Metro instead of on the road. On the road, hundreds of police have to stand, if not thousands, and you have to keep people away. It's so difficult to keep people away when the ambulance is coming, we know that. And taking all the risks traveling in that. So this is a new way. The metro in Hyderabad has shown that this can be utilized for a new purpose. So the importance here is, for our problems, we need to create the solutions. And what we create, like NVS Reddy Garu said, the way we produce vaccine in this country, and that shows what can be done in this country, and we are able to export to countries like so many countries to save their lives in addition to our people. Today, with this innovation, I'm sure throughout the country, throughout the world, people are looking at now how to make use of a special train, because this saves a lot more time and this saves a lot more police. Help them to do some other work instead of this, and avoids inconvenience to them. And not only that, when people are coming, accidents happen, there are people, doctors, staff who died with the accidents while bringing the organs on the road. So with all this, we have come out with a new way of handling things. So hopefully, so many problems are there in our country in doing a successful transplant, apart from the finances. This is one small solution the Apollo Group is able to offer to the transplant programs throughout the world. And especially we thank the police and the Metro for making this happen. And we wish that we'll be able to save more lives working together. Thank you very much.